Kushe and good afternoon. This is John Lascher from Partners in Health, Sierra Leone. Today is Sunday, April 19th. There were 5 new cases announced today, bringing the total number of cases in the country up to 35. And I'm joined by Dr. Bailor Barrie. He was in Kono for the last week. The government has asked us to get more involved in surveillance in the country and contact tracing. So, Bailor, can you tell us a little bit about these new cases, please?
We have now a total of 35 cases, 5 new cases, and one of them is from Kenima, a contact of the previously infected lab tech, and then we have one new case from Tonkolili District, which is new, and then we have the rest of the 3 are from Western urban area. And so now we have 2 cases from Kenima, 5 from Putloko, 1 from Tonkolili, 5 from Western area rural, and 22 from Western area urban.
So I know a lot of people are very concerned about the fast increase in cases. 2 days ago, 11 new cases, or 3 days ago, 11 new cases. Yesterday, 5 cases. What do you make of these new cases?
Well, it's obvious that community transmission is occurring right now because it's obvious like this new wave of cases, I think about 5 or 6 of them, that means the 15, the 11 and the 5 and 4, we have about 6 of them who are basically either secondary contacts or from the community. They don't know where they don't have a history of travel, they don't have a history of close contact to somebody that is positive. So obviously it's clear that it's community transmission is occurring in the country. And I think I applaud the government for wanting to take drastic steps in terms of surveillance and contact tracing, because I think those are the few steps that can break the transmission chain.
Can you talk a little bit about the contact tracing that PIH did in collaboration with the government during the Ebola response? And do you think that experience is going to help with contact tracing now?
Sure, and I mean, it's fortunate that I was leading that effort to develop that strategy, and it's like, during Ebola, we all know there was a lot of stigma, and people are taken to centers with no communication back to their families. And also, what we did was in Putloko and Kono District, we hired a lot of community health workers and deployed them in the community to do house-to-house screening. And while doing house-to-house screening, they're also like trying to identify sick people in the community, in the homes, and then called the surveillance teams. And then the surveillance teams will come, line list their contacts or whatever. But the difference, I think, with doing Ebola in here is that doing Ebola, they will come and take the patients away and then quarantine the whole home, the whole house. And now I don't think that's what they want to do. They want to make sure they take that patient and take him to a community isolation center. So doing Ebola, we deploy the community health workers we have three levels of community health workers: the field community health workers, facility-based community health workers, and psychosocial community health workers. So the field-based will do house to house, identify cases, call the surveillance team, and they take this patient to the facility, and then the facility-based community health worker would communicate back to the community. Like every day they will give report of what is happening to the patient so that the family knows what is happening to their loved one. And then during discharge, the psychosocial will go with the patient and then use that opportunity to educate the whole community about stigma and all those things. So yeah, during Ebola, that's the strategy. But now I think it's going to change a little bit. It's like we want to make community health workers maintain the same house-to-house screening and identifying of patients. But in this time, if they call the surveillance team, the surveillance team will come and then line list contacts of the patient, both primary and secondary contacts, and give the list to the community health workers who goes back and traces all those contacts and trace all those contacts and then communicate back to the surveillance teams what is happening. And once a patient is identified and they screen if the patient is a suspect case, they would remove that patient from the community and isolate the patient in a nice community isolation centers. And like what we're doing in Kono is like we're trying to talk to all the paramount chiefs to provide a house or a location where we can isolate this patient safely. And then if they took their test and their test comes back positive, then we can also like interview them and investigate them to get more contacts and then do a lot more contact tracing. And then that patient would either be referred to Freetown if it's severely ill, need like a ventilator or need oxygen, and if they are like mild or asymptomatic cases, they will be treated in the community care centers.
How many contact tracers are working on the current 35 cases?
I don't know the exact number, but I think it's about 100 or above 100. But I had that they're complaining that they're stretched out, that they're not enough contact tracers, and like they have a lot of cases to trace their contacts, and like they're stretched out. So I think this move would be a great move because like we're going ahead of the disease by deploying all those community health workers in the communities where even corona has not been right now, just to make sure they continue doing education and like also screening patients and make sure we pick any patient that is a suspect and test them. I think if we do that, we'll definitely break the transmission chain within the community.
What advice would you give our team right now?
So in Kono, I think we're already planning to do that, to train all the community health, all the facilities and the clinicians in those facilities to be prepared and ready to receive patients and refer patients as required. And I think we should make sure that thing happens as quickly as possible. And already we've started training the community health workers, and maybe by mid next week we'll finish that and deploy them. And we just have to make sure that we ensure that the facilities are prepared.
Are you nervous?
Well, I will not say I'm nervous, but I'm kind of like worried about this new role that it's intense. I was just laying down like 30 minutes ago, just thinking about everything that it would take to make sure this is successful. But I know that we have a good vision, and I think if we should just ensure that it's implemented as we plan it, and I'm sure it will be successful.
What are some of the questions you were hearing from staff in Kono when you were there last week?
Well, the question ranges. So one important question that I think is good that you ask is that people are asking, what about if we have one of our staff infected, what should we do? And I think Vicky also said that, and saying that we should think about a way that, or a house that we can say, okay, if we have a patient that is suspect or compromised, would be isolated if it's test positive, and we can think about how to treat that patient. But that's the question around most of the people asking, like, what about we're coming to work as clinicians, if we get infected, what are they going to do for us, and how are we going to be treated? So that's a question, and I think that's an important question.
What do you think we should do?
So Vicky and I just run through some ideas, just like broadly, like saying that, okay, like we should consider one of the guest houses in Freetown and move all the people, everyone into all the other guest houses, so that one guest house will remain if we have a suspect case, that we isolate them in that guest house. And then for positive cases, we have Martha at 34. I know if we send the patient there, is a staff, he will be well cared for, as she's caring for all other patients. So I'm not worried about that treatment. But like we need to move fast to get a house that will isolate suspect cases for Connor, for any of our staff that is suspect.
Any final words?
My final words to all the PIH family here and abroad is like, let's keep the faith. These are difficult times, but I'm sure we'll all fight it together and we'll overcome it. So, thanks.
Thanks, Bailor.
Thank you, John.